All right. Awesome. We are live here with Kara Schaub from Northern Michigan Acupuncture. So this is our June edition of our Provider Live Facebook series, which has been really awesome. So really excited to do another edition. And thanks, Kara, so much for coming on. I had the pleasure to sit down and talk with Kara last month, I believe. That was May, right? Seems like a long time ago at this point. I just want to take a second, allow you to introduce yourself, talk maybe a little bit about your background, maybe what got you into acupuncture, and then maybe just for the lay people out there who don't know anything about acupuncture, what is acupuncture all about?
Absolutely. Thank you, Kyle, for having me. So excited to be here, and it's my passion and to talk about acupuncture and educate people. And I'm always here to answer anybody's questions. So I am Kara. I am the owner of Northern Michigan Acupuncture. I've been practicing up here for the last 6 years, and I started my education at Aquinas College in Grand Rapids. I studied biology and Spanish there. So I always knew I wanted to help people work in healthcare somehow, some way. At the end of that education, I had a family member seek holistic medicine and have some really amazing results with that. So that just sort of got me thinking in that direction. The things that keep you up at night, the late night search. I found my acupuncture school in Chicago. So I graduated Aquinas in June, and then I started up acupuncture school that fall. I went to Pacific College of Oriental Medicine in Chicago. And so that was another 4-year master's program. And my grandma always likes to tell me that, I could have been a heart surgeon in that time, but I definitely could not have. I do not have I don't have it in me to do that job. But it was a long road, but I'm grateful every day for that experience, the time in Chicago that I got to work for a couple years for a bigger company. I gained some great experience. And then I just always, I'm from Michigan. I'm from the Alma area. And I've always just kind of known that Michigan needs acupuncturists. And so I always knew I wanted to bring it back this way, and very happy that I landed up here.
Oh, that's awesome. Best place to be.
Yes, absolutely.
So as your background, you got into that. Now you're obviously here in Traverse City. So acupuncture, give us some of the basics on, what it is, what it does. We'll obviously get into some of who you take care of, but give us just some of how it works and what it's all about.
Sure. At the end of the day, acupuncture is all about increasing blood circulation in the body. And it really helps to reset your nervous system, take your body from that fight or flight response that we're all in all day, every day, to the rest and relax state. So it really just shifts all systems in the body. Of course, the nervous system controls everything. And so that's one of the many reasons that people tend to find just a lot of issues, problems that maybe we didn't even discuss tend to fall in place with acupuncture, because it's all related. Your sleep, your digestive system, your cardiovascular system, your lymphatic system, your reproductive system. It's all very connected. So
yeah, that's awesome. So nervous system. So for people who don't know those different parts you mentioned, right? You mentioned the fight or flight. You may have mentioned the rest and digest. So those are what we call the sympathetic and parasympathetic sides of the nervous system. That's stuff we talk about a lot, in terms of chiropractic and working with the nervous system. And I think you're 100% right, whether it's acupuncture, whether it's chiropractic or other things you can do. So many people are wrapped up in that fight or flight, just like you said. Like, unfortunately, a lot of us are just living our lives in that all the time. And that's a system that's supposed to be only for, essentially, it's supposed to be for emergencies for the most part. It's supposed to be if we're in like a life or death situation. our blood pressure should go up, our heart rate should go up, maybe we're sweating, pupils get big, like all these things, because it's like a dangerous situation, survival instinct from our body. And unfortunately, people get stuck in that, like for days and weeks and years, and like your body never comes out of that. And so part of the problem, as you can elaborate on here, is like you can't be in both systems fully at the same time. So if you're in that system, you can't be in the rest and digest, which is, like it's named, your sleep cycles, your digestive your digestive systems, your immune system. Like think about it, if you're in a dangerous situation, your body's trying to protect you, like a tiger jumps out of the woods and you got to run, like, is it worried about digesting that berry that you just ate? Probably not. It's probably going to put it on hold,
Yes.
So, so I'm sure you see things all the time where people are like, I'm sleeping better. My digestion, is that connected to what you're doing here? Like they ask you those questions, I bet.
Yes, absolutely. And a lot of times that's what I think healthcare is all about, just helping people connect those dots and finding, I'm always saying you just have to take your health into your own hands, find the things that work for you, find the right team that's going to basically help regulate your nervous system. I think that is a common theme with all people like yourself that I've met with and other healthcare professionals in town.
Yeah, that's awesome. So just a little more elaboration, right? Because I know there's a lot of people that haven't done acupuncture, aren't familiar. So obviously you talked about the nervous system. So can you elaborate a little more? Obviously there's needles involved. Like how, first of all, explain the needles, how they're safe, like that kind of thing. And then how does that exactly affect the nervous system and like what's going on in your body as that happens?
Sure, absolutely. So acupuncture is, it's a self-healing mechanism. So I have the tool and, the education, right? I know where to put the needles and how to safely do it with the, sterile single-use needles that I've got one here I'll show you. I've also got my acupuncture model friend here, and he has all the acupuncture points and channels on his body. You met him when you were here.
Yeah.
And so, he just helps explain and show a little bit how many points, how many channels there are. And and when I say it's a self-healing mechanism, when I place the needle in the body into the point that has been known for thousands of years, your body starts to send blood, oxygen, nutrients, all of those healing mechanisms to that point, activating the point and all of its healing properties. So that's sort of, I'm always saying acupuncture, it's like there's plenty of good science. I, have a science brain. I talk in a pretty Western tone, and when explaining acupuncture, I just feel like it's important to have that sort of tangible to really be able to understand it. I'm saying acupuncture is a little bit of science, a little bit of magic. I think that there's so much more to it that maybe I will not understand even in this lifetime. It's a deep healing science there, but also I've seen it work so well for so many different things.
Well, I think it's just a homage to like the body and just how amazing of a creation that the human body is. I feel the same way. Like I am very analytical brained. I love like the way we approach chiropractic in the spine is very analytical based. We're taking measurements. We're trying to get it to an ideal model, like all of these things. But I also know that I don't know everything that's happening in the body. And I don't know exactly every mechanism of how certain people's ailments are healing or going away or things. And it is just truly amazing. Like I don't think it's possible to ever know everything that's going on inside the human body, no matter what doctor or no matter who it is or what they want to say or claim. A lot of people know a lot of things, but I don't think anybody knows everything. And it's just such an amazing ecosystem within itself of just the harmony of the body and how every system affects each other, like you were alluding to earlier. So I 100% agree. So let's get in. We had a couple specific topics we want to talk about today. I know we had like muscle tightness, headaches, nerve pain. Both you and I both deal with each of those things quite often. So I guess just give us a little breakdown, like a muscle tightness. Probably one of the common things they see. Maybe what are some of the mechanisms that you do know of how some of those muscles can start to release? And is there any specific things you see more often when it comes to muscle tightness?
Mm-hmm. Yeah, I'm always saying acupuncture and tight muscles are best friends. They just work really well together. Kind of like you touched on, the body is so intelligent that with acupuncture, I'm always saying we're trying to just send it a very clear, direct message. I'm never using 100 needles on a patient. I would say I use between 15 and 20 needles because the body, that's, and if that, it really depends. But yeah, with tight muscles, what acupuncture is doing is it is stimulating what's called the neuromuscular junction, or just where the heart of the muscle belly, where everything meets up for the trap. The trap, for instance, the trapezius muscle on the top of the shoulders. Pretty much everybody knows that one because we all really feel it and have felt it at some point. If anybody has ever touched their shoulder or had anybody else touch it before. So with acupuncture, that's the area that I am going to be going for with my needle insertion to release that muscle, to reset it, to take it from a shortened and contracted muscle to lengthened and relaxed. So, a question I get a lot is acupuncture painful? And, pain is definitely not what we're going for. So, but sometimes you can feel a muscle twitch. And, that's that muscle resetting. That's a good thing. So that's, again, just instead of having that muscle on and firing contracted, we want it lengthen and relax to help alleviate, any sort of symptom you might be having, tension, headache, and so on.
That's cool. So I imagine the healing response there, you mentioned earlier, bringing blood flow into the area. So when it gets that blood flow, it's able to move out, kind of like the pooling blood or things like that are sitting there stagnant, or lactic acid or whatever is built up in there. And it brings fresh blood in, which obviously would mean oxygen, nutrients, those type of things. And that's what's sending those signals to help that muscle to relax. I would assume that's one of the main mechanisms there.
Yeah, exactly. I feel like over my years of practice here, it's, in my mind, it's like pain has to go somewhere. It's not just going to totally dissolve. So we basically have to find where that is, release it, release that so that your lymphatic system can clear that out, and the muscle can be, reset. But yeah, in Chinese medicine, when you have pain, you have a lack of free flow of blood and qi, which is your body's just energy. We are more than just blood and bones, for sure. So, yeah.
Oh, that's cool. So you mentioned headaches as well. So, and specifically tension headaches, which goes right along with tight traps, and cervicogenic headaches, which means can stem from the musculature in the neck. Are there, I imagine you probably have success with all types of headaches, but for people who don't know out there, there's things called cervicogenic headaches, there's occipital headaches, there's cluster headaches, there's migraines. And I guess one question I have is, do you treat, and have you seen success with all types of those different types of headaches? And or are there more frequent ones you see, or that more, I guess, like your bread and butter that you're like, oh yeah, we see this all the time and we do great with this specific condition?
Yeah. Yes, all the headaches. I am a migraine sufferer myself, or can be if I don't take care of myself and do preventative measures. But yeah, acupuncture is so helpful for sinus headaches, helping to alleviate any of that sinus pressure, and hormonal headaches as well, because it is helping to regulate cortisol, which is a stress hormone. So that can just help regulate all other hormones in the body. So a lot of times people will get multiple types of headaches. They're usually not just one type, as we know. So that's, another way that acupuncture can shine. It's like, okay, we can do the sinus points, we can get the tension points, we can also address maybe any sort of underlying hormonal imbalance you might have that's causing you to have hormones around or headaches around your menstrual cycle. Um, and what other type of headaches are there? You said the cluster ones. I've, I don't know if I've ever had a cluster headache patient, but now that we're talking about it, I'll get one like tomorrow, you know.
Most likely.
But I would love to have a cluster headache patient. Not to, I don't want anybody to ever have a cluster headache, but it would be.
That's awesome. Well, that gets me thinking already, just, from a referral standpoint, like obviously what we do from a musculoskeletal basis, in our office, we're evaluating posture, we're evaluating, structure. So we're looking at the spine. Oftentimes people with headaches, we see one of two things almost every single time. One is a large forward head posture. So they have, anterior head where their head's coming forward past their shoulders. Obviously, that leads to extremely tight traps, like you touched on earlier. All these muscles are firing back here 24/7 because they're trying to pull the head back and the head's not coming back. So those never turn off. So that's one. Or the other one we see a lot is actually a loss of or a reverse cervical curve. Because that changes all the muscle structure with the tiny muscles that connect all the vertebrae and all those different things we have in there. And then it also puts tension on the actual spinal cord. So if you lose the curvature in your neck, it actually bends the spinal cord the other way and puts tension on it, which is just an extension of your brain. So pretty big deal there. But that's not going to address quite as much the hormonal side of things, maybe the sinus side of things. So that just already gets me thinking, we're correcting these things. Maybe if there's still symptoms lingering, that's a really good referral option for us to send over to you at that point. And so having said that, here's a really good question, I think, at least. If, say in that situation, so say I'm talking to a patient and I'm like, hey, I want you to go see Kara, I want you to, get checked out, see if we can get some more resolution of these headaches. And they're like, okay, well, what should I expect? So walk us through that real quick. I know it's a little off topic, but a new patient comes to see you. What does that look like? Is there kind of like an evaluation? And then like, what does a treatment look like? How long does it take? Those kind of things.
Yeah. So I would say your first treatment is either about an hour and a half or 2 hours, sort of depends on how much we have to go through with the health history, how many questions somebody might have for me. I always like to leave plenty of time for that. And, plenty of time for us to be able to thoroughly talk about anything that we need to, and for the patient needs to be able to feel comfortable and trust me. I would say, first of all, acupuncture is not so mainstream yet. So usually there's some questions and some things out there. So the first visit is a little bit longer, and then follow-up visits are usually shorter, about an hour long. And so, yeah, the first visit's about 30-45 minutes of talking maybe. And then I'll put the acupuncture points in, and then I'll let the patient rest for about 20 minutes or so. And then, it might depend on if I do any sort of cupping, gua sha sort of accessory technique. I tend to add that on to my treatments as well. And so, yeah, that's sort of what that first visit looks like treatment wise. And then, yeah, with acupuncture, of course, it's not usually just a one and done sort of a treatment. So treatment plan wise can vary, of course, depending on what we're working on, how severe the issue is, how long it's been going on for, and just really what the patient's goal is. Sometimes people come in and they're just curious, and it's just a general wellness health sort of a thing, which is obviously a very great place to be. But I guess, unfortunately, that's not usually the case. Usually people find me and they are in pain. And I'm just so happy that they found me, because it just takes so much energy to be in pain and to keep sharing your story over and over again. So it's nothing that I take lightly as a practitioner when somebody is investing their time and energy to be in there. So I try to not ever make anybody feel rushed in my practice as well. And their treatment, they're here for relaxation you're not supposed to stress about making it to your acupuncture treatment. That sort of defeats the whole purpose. We're going for the rest and relax.
Mhm.
So I try to be flexible and, and take my time with people. So
No, that's great. So what you said, obviously treatment plans vary. Um, give us like a ballpark range, kind of mild spectrum to severe spectrum, what that might look like.
yeah, so at first, if somebody is coming in and they're dealing with quite a bit of pain, we might do weekly treatments. If it is pretty severe, it might call for twice a week, even for the first couple of weeks, if everything allows for that. But typically, I would say once a week for 4 to 6 weeks is sort of an ideal, just for the body to really be able to like adapt and feel all of those changes. Especially if it's something brand new for you. And then my goal is always to get somebody to that sort of once a month, once every 6 weeks. Um, some people come every 2 weeks, some people come every 3 weeks, or as needed, or in a crisis. That's good too. We need them all. So no judgment there, because life is busy, and I'm happy to be here for people if they need me in a pinch. But yeah, so
Yeah, it's funny how much our disciplines have in common, right? It's like, man, we wish every person came in on a wellness basis and we're just like, yeah, I just want to be the best I can be and not get worse. And I want to have a perfectly aligned spine, or I just always want my nervous system tuned up or whatever. That happens like 1% of the time, typically for me.
yeah,
Like it's always a pain, some kind of symptom or pain that drives people in, which I totally get. I mean, that's human nature. So no judgment, but yeah, it would be nice if it was more people coming in on a wellness basis for sure.
yeah, yeah. I feel like an underlying thing that I find too is, and that I love, is to keep people doing what they love doing.
Mhm.
Right. That's why I think I treat a lot of golfers. They want to keep golfing and they're motivated to do that. So they'll come in and get their acupuncture,
Yep. No,
and
spot on. If I
that's,
couldn't golf, I'd be there tomorrow.
yeah, if you can't like pick up your kids, your grandkids, travel, walk, do all the things you want to do, I think that that's what it's all about. And that tends to be the people that seek out treatment um, from me, that are, yeah, just want to keep doing all the great things, and are maybe just, not getting the results that they want to with medication, or they're just not even interested in doing that route at all. And obviously, the least amount of medications you can be on is ideal. I think anybody would agree to that.
Yeah, I think so. We know there's a time and a place, right? But if you if you look at two people's cupboards, and one's full of medications and one's not, who would you think is healthier, right?
Right.
Probably the not. So try to stay off as many of those as we can for as long as we can. So kind of last topic here is nerve pain.
Yes.
I know both of us deal with a lot of nerve issues. We treat a lot of peripheral neuropathy, obviously radiculopathy, which is nerve pain stemming from the spine, maybe from the neck down into the shoulders, arms, and hands, or the low back into the legs, or the glutes or things like that. So from what you do, talk to us a little bit about nerve pain and a little bit about how acupuncture helps address that as well.
Sure. Yeah, of course, I think nerve pain can be caused by many different factors. Sometimes we don't even know what's causing it, right? And again, I'm always the first to say I'm very biased, but just another way that acupuncture is that it doesn't really matter. It can be helpful for all sorts of nerve pain, whether it's like the tight muscles that we've talked about with the traps, or the glutes that are then causing like the sciatica, or tingling, numbness down the arms. Acupuncture is great at helping to alleviate that. All these forearm muscles, I'm always treating those to help alleviate just all the symptoms that it tends to cause downstream. So
That's cool. If you, one thing I just thought of as you're talking about the forearms there, do you see a lot of carpal tunnel, and have you gotten good results with that?
Yeah, definitely a lot of tingling and numbness. People that, come in that use their forearms a lot, bakers, baristas, musicians, people like that. Just, and then just all the desk jobs too, that cause that. So and then as far as acupuncture and the nerves and nervous system, you can just sort of see how overlaid it is with like where our nervous system would run and where all our veins and capillaries run. So just by inserting those needles, increasing that blood circulation, you're going to be stimulating and regenerating those nerve pathways that we know, thank goodness, can be restored. And that's how people can recover from strokes and things like that, because the body is so intelligent and it does want the best for us. It wants to live and survive and do well. So I feel like it's just, it's really listening for those little signals, and acupuncture is just a great one that is a very safe and effective way to do so. So.
Yeah, that's awesome. I think spot on with pretty much finding the cause, right? Like, what's the root cause of this pain? Sometimes you're right. We don't know the exact root cause, but if we can uncover that, well, then remove the cause, try to fix the cause. If it is maybe tight muscles or different things, we want to remove that. And then from there, it's making sure that the nerve can heal. And that can take a lot of different routes, from, different modalities to help with nerve regeneration, to making sure we have the right nutrients and that it's getting the oxygen through the blood flow. So it's got to have blood flow and nutrients in there. And so it's kind of like, hey, what caused this? Let's find that first. And then after that, how can we support the healing process from there on out? So, and I'm sure you talk to people all the time about stuff they can do at home, and how can you be well all around. You can't just leave here and hit McDonald's and smoke a cigarette on your way home and hope that you're going to be in good shape, So I think most people are figuring that out, but we got to let people know.
Totally.
So, Kara, what is the best way someone wants to reach out to you if they want to try acupuncture, they got something they want to talk to you about and get your expertise on? What's the best way for them to get a hold of you? And then also, where are you located at in Traverse City?
Sure. They can email me at schaubkara@gmail.com. They can look at my website. That is northernmichiganacupuncture.com. I'm also active on Instagram at Northern Michigan Acupuncture. And then I also, I just give out my cell phone number to people. Happy to, text or chat anytime, anything acupuncture related, or to help people get scheduled. I have online booking, but I understand that's not everybody's cup of tea. So happy to help out with that. And so, my phone number is out there as well. And then I am located at 601 South Garfield. So it's right across from that Trailside 45 condo building. And there's another performance chiropractic over here, and a dentist, and some other offices. And then,
Oh, that's awesome. So anyone who wants to reach out to Kara, you got lots of options there. You can go to website, you can email, all those fun things. So if you guys, anyone out there listening, needs any help, if you got headaches, muscle tightness, all these different, symptoms or different issues we talked about, and you're looking for your body to actually heal and go a natural route, and, hopefully not just go with a Band-Aid, like a medication or something like that, reach out to Kara. You can reach out to us at Shift. We're both here to help Traverse City be the healthiest community possible. So thank you so much, Kara, for hopping on. It's been awesome.
Awesome. Thank you so much for having me.
Yeah, no problem. Have a good day, everybody.
You too.